that is Bachelor of Dental Surgery from Kemsha Dental College and Hospital. And apart from that, I have done a fellowship course in endodontics and prosthodontics. That is all about your RCT, root canal treatment.
Going back to the question that I had, where I asked you why is the oral cavity a different branch. You said that, and if I'm not wrong, that a dentist needs much more practical experience and practical exposure rather than a medical MBBS person, MBBS graduate. Let's say. Is it the case then that as you told, MBBS would get their hands on patients only after their third year, after the theoretical is done? Is it the case that dentists who are coming out, who are doing the BDS, get their hands on, or who get their practical experience before that? Do they get it before the third year? Do they get it in second year or first year?
No, we do get our patients from third year itself. We start doing basic dental treatment from third year itself. And MBBS students, they get into clinical aspect from second year onwards, but then their practical knowledge, the practical work, what they do is after third year. Yeah, and
whereas for you, that starts after second
from
year.
Third year itself. We start doing our practical work from third year itself.
Okay. Yes.
We have our patients from third year onwards. So practical knowledge wise, if you see, yes, we do have basic knowledge like of teeth extraction, then we have restoration part, we have impression taking, we have denture makings, we handle pediatric patients from third year itself. So the practical knowledge, if you compare, then yes, we do have a practical knowledge from third year itself.
Understood. Makes sense, right? Is there an advice that you would like to give to anyone who is entering, who's entering the first year of his BDS, is just completed his NEET PG and has given his test, is going to enter his BDS first year? What is the advice that you would like to give to him?
For people who are freshers, who are, giving their NEET UG or are selected for the counseling as a first year BDS or MBBS, what I'll advise them is make your basics crystal clear, right? You need to make your basics very clear, because from day one itself, you have to have all the knowledges, because each year is interrelated, right? The first year, second year, final year, third year, every year is interrelated. It's not just that in first year, if you read anatomy, you don't need to, read it in second year or third year or final year. Right. Every year is interconnected, right? Interrelated to each other. So you have to make your base very clear. If your basics are clear, you will not face any difficulty in coming years, right?
Any other things that you would like to tell NEET PG people who are preparing for their NEET exams coming December 2021?
Yes,
I did. You would like to advise?
I did advise them about non-clinical subjects. Focus more on your non-clinical subjects, because that is going to fetch you more marks as compared to clinical subjects. Because I did appear for NEET this time, NEET PG. Right. And what I learned is I need to make my diagnosis, my case presentation and everything clear. Like I should know with I should know what diagnosis I should make with this condition. So that comes under your non-clinical subjects, which you should, be clear with. So for last few months, you can keep your clinical subjects, but initially if you're starting your preparation, I think you should start it with your non-clinical subject. That is going to actually fetch you good marks.
Great.
And that is a rank decider subject.
So where can everyone who wants to reach you, Ankita? Can you tell me a bit more?
They can reach me on my mail ID.
Great. So I'll post that mail ID below in the description.
Sure.
And you can go ahead and ask me any questions that you had.
Yes, I am so curious to know from where did you get this idea of interviewing normal people? Because people are more eager, to interview celebrities, to know their life, to know their passions, their hobbies, but why common people? Why common people around you? Why them?
Right. The celebrities, the people who are very famous, we have always heard their interviews, always heard their life, we have always heard their struggles, and that's something that's motivating for everyone, And that's true, that's correct, that's good. What I am trying to focus on is the normal person. Normal person, when I mean to say, is a common man who works for his family, who earns for his family, works from 9 to 5, struggles because of the kind of inflation and economical problem people have. People also kind to try to have a side hustle at the same time. And people are trying to make as much as they can to support their family, to support themselves. And even before the pandemic has been really hard for everyone. And even before the pandemic, life is really hard as a whole. It will throw stones at you, and you will have to answer all of those problems, all of those stones that it throws at you. And you will have to do all of this with a smile. No one actually shares with you what they're going through. No one comes up to you or me and shares with you. Only it's only when you sit down, like we're having a conversation right now, that people start telling you their problems, their experiences, the things that they have learned through their life and through their struggles. And this can be valuable to anyone. Specifically during the pandemic, it has been a case in which people would sit back in their homes, not do anything, not interact with anyone, just have to work on their own. And that's now not how human beings are made. We are social people, right? We are social beings. We need to interact, we need to sit together, we need to talk, we need to laugh, we need to eat together, watch television together, we need to be a family together. And that's what's missing from people nowadays. You really need that social feel. And we have missed that. This pandemic has asked us to miss that, and it's for the betterment of everyone. This had to be done. It would not have had happened if everyone would have not followed. And it's commendable that such a big community of almost 8 billion people in the world have come together and followed such a crucial task. And it's been a really hard time. And what I wanted to do is bring out these stories, these small problems that people face, these small journeys people have had, and these all of these experiences. So I am really interested into all of these. I have loved these stories, I have loved these experiences. And I felt that now that we have this medium, YouTube, Instagram and stuff like that. Again, in Instagram, Facebook, all of these social media, you always see the beaches, the mountains, the happy times, the plates filled with food and happy faces. And that's not the reality. Again, that's not what people are going through right now. People are facing problems, and they would not show that. That's not something people show. That's not for everyone to see. Not everyone is that okay with it, and that's fine. But if a person is okay, I would love to learn and understand his or her struggle, to see what he has or she has been through, what she or he is felt. Why did he take a certain decision? What was going inside his mind that he took this certain decision, and stuff like that. So that's what my inspiration was, when I started out this channel. Thank you very much, Ankita, for taking out the time and being with us here today. It was really nice hearing about your experience. Thank you very much. Hope I'll bring you again after you are
Thank you for
with your
having
NEET
me
PG.
here.
Great. Thank you very much. Bye-bye. See you.
Bye.
Thank you very much for watching the second part of the video. In the first part, we talked a lot about how she started out, what was the reason she came into dental science, what happened, and how was her journey during the dental science, during her BDS actually, during her bachelor's in dental surgery. In the second part of the video, we talked about the advice she would like to give to incoming batch of people who are going for their bachelor's in dental surgery, for people who are preparing for NEET PG, and you also heard a bit about why I started this particular channel. So thank you very much for watching the second part of the video. Do like, share, and subscribe this video. If you like the content that you saw, check out the other content that is present on the channel. Do subscribe. Thank you very much.